Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Unified Huntington's Disease Rating Scale assesses motor function, cognitive abilities, behavioral abnormalities, and functional capacity in individuals with Huntington's disease. Its main purpose is to provide a standardized tool for clinicians to measure disease progression and severity. The scale evaluates chorea, dystonia, eye movements, and speech impairment to monitor motor symptoms. Cognitive domains such as attention and executive function are assessed to detect neurodegenerative changes. Behavioral assessments focus on psychiatric symptoms, including depression and irritability. Functional capacity is measured to determine the impact on daily living activities. The scale supports clinical management and research by enabling consistent and objective evaluation across different stages of Huntington's disease. The Unified Huntington's Disease Rating Scale is indicated for patients diagnosed with Huntington's disease, including those in early, middle, and late stages. It is most useful in clinical settings focused on tracking disease progression and assessing motor, cognitive, behavioral, and functional changes over time. The scale facilitates standardized evaluation in both research trials and routine clinical practice. It helps clinicians quantify disease severity and monitor response to therapeutic interventions, supporting decision-making for patient management. The Unified Huntington's Disease Rating Scale consists of 4 sections: motor, cognitive, behavioral, and functional assessments. The motor examination includes 14 items assessing eye movements, dysarthria, chorea, dystonia, and gait. Each motor item is scored on a scale from 0 to 4, with higher scores indicating greater impairment. The cognitive section evaluates verbal fluency, symbol-digit modalities, and Stroop interference using standardized tests. Responses are recorded as raw scores reflecting correct responses or reaction times. The behavioral assessment contains 11 questions rated for severity from 0 to 4, focusing on mood, irritability, and psychosis. The functional assessment comprises 13 items measuring independence in daily activities, employment status, and level of care, scored from 0 to 7 based on the level of dysfunction. Clinicians administer each section according to standardized instructions, ensuring consistency in scoring. Total scores for each domain are calculated by summing individual item scores. Motor scores can range from 0 to 54, with values below 5 indicating minimal motor impairment. Cognitive raw scores are compared to age-matched normative data. Lower scores indicate cognitive decline. Behavioral scores above 12 suggest significant psychiatric symptoms. Functional scores below 7 reflect loss of independence. The composite score aids in disease stage classification, with early-stage patients typically exhibiting motor scores under 20 and functional scores above 5. Regular administration facilitates monitoring disease progression and treatment efficacy. The sensitivity of the Unified Huntington's Disease Rating Scale refers to its ability to correctly identify individuals who have Huntington's disease, while specificity denotes its capacity to correctly exclude those without the disease. Studies indicate that the sensitivity of this scale in detecting motor symptoms associated with Huntington's disease ranges from approximately 0.8 to 0.95, reflecting a high probability of identifying true positive cases. Specificity values are generally reported between 0.7 and 0.9, indicating a moderate to high rate of true negative identification. In a clinical setting, a sensitivity of 0.9 would mean that 90% of patients exhibiting motor signs of Huntington's disease are accurately detected by the scale. Conversely, a specificity of 0.8 suggests that 80% of individuals without the disease are correctly classified as not having Huntington's disease, reducing the risk of false positive assessments. These parameters underscore the scale's reliability for both diagnosing and monitoring disease progression. The Unified Huntington's Disease Rating Scale was developed in the late 1990s by a consortium of investigators aiming to provide a standardized instrument for assessing the clinical features and progression of Huntington's disease. Its validation has been supported by multiple studies demonstrating strong psychometric properties, including reliability, validity, and sensitivity to change over time. Initial studies by Huntington Study Group investigators reported inter-rater reliability coefficients exceeding 0.9, indicating excellent agreement among clinicians. Construct validity was established through significant correlations between the scale scores and established measures of motor, cognitive, and functional capacities. Longitudinal research further supported its sensitivity, as changes in the scale scores corresponded closely with disease progression stages. Subsequent analyses by researchers such as Schobel and colleagues have confirmed the scale's utility across diverse patient populations and clinical trial settings, reinforcing its role as a robust tool for both clinical and research applications in Huntington's disease management. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.